Absolutely. So let's start with access to dermatologic care as number one. Number two, I would say insurance coverage towards treatments for vitiligo is very limited. And then number three, also just the ability to be able to comply with certain treatments. And I'm happy to elaborate more on those if you want, but I would just say those are the top three things that I typically encounter. It's almost disheartening to know that among the United States board certified dermatologists, there's about 3% of us dermatologists that may identify as African Americans. There's about maybe 3 to 4% that are Hispanic or Latinx dermatologists. So access to diversity of specialists with skin of color training and education is very limited. More importantly, vitiligo, because it's a disorder of visual impact, not necessarily direct physical impact. I think to the eye of health insurance companies, is seen or easily distinguishable as cosmetic when it's not really cosmetic. It's really caused by a medical problem. So therefore, we battle a lot with insurance companies as far as like, what do they cover? What medications do they cover? What treatments do they cover? And so forth. For instance, I have a patient that I've been taking care of for the last several years, where during the pandemic, he wanted to get a light therapy box, covered so that he could do it at home. And most insurance companies were fairly understanding during the pandemic that patients normally would have to go into the hospital and get phototherapy treatments, but his insurance company kept denying the at-home therapy box because they said that they want to only pay it when in the hospital setting. But in the midst of a pandemic, who's going to be going to the hospital 3 times a week for therapy sessions that they could do at home? So those are some of the struggles and battles that we face when caring for vitiligo patients.